Welcome to FamilyDoctor.expert. I'm Grant Blaschke. Today we're talking about eczema. Eczema is very annoying for people. They get dry, red, itchy skin. Very often in the places where your skin bends, in the elbows, behind the knees, around your neck, often around the eyes. We see some people get it in their hands. And it can be quite distressing and very annoying for people. It can vary from just a bit of mild eczema to really quite a serious disease. What causes it? It's genetic, and we know that it's to do with the genes which create a special chemical which is a barrier for your skin, and people who tend to get it don't have enough of that barrier. Now, it's associated with some other what we call atopic diseases, things like asthma, hay fever, and some allergies. Now, a lot's made about food allergies as being a cause of eczema, although according to the studies it's a pretty rare cause of eczema. If you think that food is part of the cause of your eczema, rather than just randomly start avoiding foods, I really recommend you get a proper food allergy test to decide if you are really allergic to food or not. What are the risks of eczema? Well, apart from it being annoying, the main issue is some people get secondary infection, so you are at increased risk of getting a staph infection, or even occasionally herpes from a cold sore or warts, so that's something to be aware of. Now, what can you do about your eczema? Heat is the enemy. You don't want to get overheated in bed or overheated with the clothing that you're wearing or with the heating. Some chemicals can set it off. Avoid perfumes or any chemical contacts. Some people who really run into trouble with it with their hands have to wear gloves to avoid the chemicals on their hands. Sweating can be a problem. Some sports people have difficulties with eczema. So what are the other things that you can do? Avoid soaps. So use, there's some non-soap products, sorbolene cream, bath oils, those sort of moisturizing creams rather than strong soaps. Soft clothing is good, cotton in particular is good. Keep your fingernails short, so if you happen to itch it during the day or even at night when you don't notice, that you don't rip away at the skin. A little bit of sun is good without overdoing it. In fact, some of the skin specialists give UV treatments for the eczema, which can be quite helpful. Seawater can sometimes be helpful if you're in a situation where you can go out in the ocean. Now, in terms of topical treatments, there's a range of moisturizers that you can try, and then there are also some anti-inflammatory treatments that the doctor might suggest. And there's one called Elidel, which can be really quite effective at dampening down some of the inflammation. The other ones that we very commonly use with eczema are the steroid creams. There's some a whole spectrum of those, from some pretty mild ones that you can get over the counter, such as hydrocortisone, through to a whole range of stronger ones, for example monomethazone, which is really quite strong and you just use very sparingly. The steroid creams have to be used carefully, and never use one on your face unless you've checked it with your doctor. With continued use, they can cause some thinning of the skin and leave some nasty looking red marks, so we don't want that, so check with your doctor. There's some other treatments as well. There's coal tar for people that have really got very irritated skin. My approach with the eczema is that I notice a lot of patients sort of half treat it when it stirs up and then have it grumbling along, and they're trying not to use too much of the cortisone cream, and it's just sitting there. My approach is to, when you get an eczema flare up, to treat it really quite vigorously, try and tone it right down, and then once it's settled down you can use the moisturizers and the bath oils to try and keep it from coming up again. So as usual with all these videos, if you're having any problems, or it's important to speak to your regular doctor, and I wish you well from FamilyDoctor.expert.